Welcome to the Documentation and Coding Compliance Tip. This is part 2 of injections. We're going to talk about charging for wasted medication and CMS appropriate use of modifier JW. Modifier JW is a HCPCS Level 2 modifier. It was created by the Centers of Medicare and Medicaid for Part B drug claims for discarded drugs and biologicals. JW definition of that modifier is a drug amount discarded, not administered to any patient. Now, this modifier is billed on a separate line, will probably provide payment for the amount of the discarded drug or biological. Modifier JW, when billed on a separate line, will provide payment, and there are reimbursement restrictions. So we need to make sure that the claim is compliant. It's not permitted when the actual dose of the drug or biological is less than the billing unit. Documentation is required in the medical record indicating the amount of wasted and administered medication. JW modifier is not used on claims for drugs or biologicals provided under the Competitive Acquisition Program or the CAP program. Utilize payer guidelines prior to filing a claim when using modifier JW. Now, the following slides provide questions and responses that are posted on a CMS fact sheet related to this matter. Question 1. What is the JW modifier? Well, CMS's response is, it's a HCPCS Level 2 modifier used on a Medicare Part B drug claim to report the amount of drug discarded and eligible for payment under the discarded drug policy. The modifier shall only be used for drugs in the single dose or single-use packaging. Question 2. What is Medicare Part B's payment policy for discarded drugs? CMS's response is Medicare Part B also pays for the amount of drug that has been discarded, up to the amount that is indicated on the vial or package label. The discarded drug amount is the amount of a single-use vial or other single-use package that remains after administering a dose or quantity of the drug to a Medicare beneficiary. Question 3. Why did CMS establish a national policy for the JW modifier? Well, this is CMS's attempt to establish a consistent policy among all Medicare administrative contractor jurisdictions for the use of the JW modifier for discarded drugs that are associated with Medicare Part B. Prior to CMS issuing this policy, Medicare Administrative Contracts, or MACs, had a choice whether to require the JW modifier or not. Question 4. Is the JW modifier required on claims for single-dose drugs and biologicals? And the answer is yes. Effective as of January 1st, 2017, modifier JW must be used to obtain payment for a discarded amount of drug. Question 5. In which settings is the JW modifier required? CMS's response is the JW modifier will be used mostly in the physician's office and hospital outpatient settings for beneficiaries who receive drugs incident to physician services. The JW modifier requirement also applies to critical access hospitals since drugs are separately payable in that setting. The modifier may also apply to some drugs furnished by suppliers such as pharmacies. However, CMS believes that those suppliers, particularly those who dispense drugs and do not actually administer the drug or sell partial vials of sterile products, would not have discarded amounts to report on claims. The JW modifier does not apply to drugs or biologicals administered in a rural health care facility and FQHC. Exceptions are the influenza, pneumococcal, hepatitis B vaccines, which are paid separately a cost through an RHC or FQHC cost report and not by way of the claim. JW modifiers are not intended to be used on claims for hospital inpatient admissions that are billed under the Inpatient Prospective Payment System. Question 11. How are providers and suppliers to bill using the JW modifier on claims? CMS states that the drug discarded should be billed on a separate line with the JW modifier. The unit field should reflect the number of units or the amount of drug discarded. Please refer to the example in the Medicare Claims Processing Manual, Chapter 17, Section 40. Question 12. Instead of reporting a second line with the discarded amount and price, may a provider report one line with the amount used and the adjusted price? And Medicare says no. To identify and monitor billing and payment for discarded drugs under Medicare Part B, CMS requires the use of JW modifier on a separate line on the claim. Question 13. When using the JW modifier, should the dollar amount be included on the wastage line, or should the line reflect units only? Well, general billing rules may require a charge be included on each line of the claim. You need to contact your local MAC for further billing instructions. Question 14. Does CMS have specific requirements regarding documentation for discarded drugs? And is there a specific area in the medical record where the administered and discarded amounts should be documented? CMS expects providers and suppliers are going to maintain accurate records for all beneficiaries, as well as accurate purchasing and inventory records for all drugs that were purchased and billed to Medicare. Check the Medler Manners article and also check with your MAC. Question 15. Will CMS accept an automatic calculation of waste, for example, a calculation done by software, as documentation of waste within the record? CMS doesn't care as long as the documentation accurately reflects the amount of wastage. For additional resources on this very important compliance topic, please see the Medler Matters MM9603, and also please reference Chapter 17 of the CMS Medicare Claims Processing Manual, specifically Section 40. Consider enrolling in the Comprehensive Clinical Documentation course and consider becoming a certified medical documentation professional for the outpatient physician office through our organization, the American Institute of Healthcare Compliance. Questions? Go to our website,